I will demonstrate the process of making a provisional or temporary crown using a polycarbonate crown form. This crown form comes in all tooth shapes and reduces the amount of trimming that must be done later to replicate the missing tooth structure. The polycarbonate crown form does not fit the prepared tooth. We will line it with a material that fills in the crown form and fits the prepped tooth. Trim the polycarbonate crown to fit the prepared tooth by cutting at the gingival margin. Leave the tab at the incisal edge. This will help in removing the crown form. Coat the tooth preparation with petroleum jelly to prevent the lining material from sticking to the tooth. The methyl methacrylate lining material is also irritating to the skin, so you must wear gloves. To mix the lining material, dispense liquid monomer into the Dappen dish. Add 3 times this amount in powder and cover the liquid surface evenly. The correct ratio is 1 part powder to 3 parts liquid. Add additional powder to make a thick mix. The consistency should be creamy and sluggish. The material has a working time of 2 to 3 minutes from the start of the mix. Fill the polycarbonate crown with lining material. Insert a plastic instrument to the incisal edge of the crown to eliminate air bubbles. Allow the lining material to set for 30 seconds until the surface is dull. Place the polycarbonate crown over the tooth preparation and hold it until it reaches a rubbery stage. An extra piece of lining material kept outside of the mouth can be used to determine when this has happened. The lining material has an exothermic period lasting 4 to 7 minutes from the start of the mix. It is important to remove and replace the temporary crown during this period to prevent thermal injury to the pulp. Allow final hardening outside of the oral cavity. An acrylic burr on the slow-speed handpiece can be used to trim excess resin from the gingival edges. It is also useful to remove some resin from the interior to allow space for the cement. In order to cement the crown, we will be using zinc oxide eugenol in a paste form. If the final restoration will be made of composite material or cemented with composite-based cement, then you must use non-eugenol temporary cement. Rinse and dry the temporary crown thoroughly and remove the incisal tab. Clean the petroleum jelly from the tooth preparation. The tooth can also be polished with pumice. Extrude equal amounts of zinc oxide eugenol in paste form onto a small mixing pad. Mix the base and the catalyst together all at once until homogeneous. Gather cement onto the tip of a plastic instrument. Coat the inside edges of the temporary crown up to the gingival margin. Do not fill the crown entirely with cement, or air will be trapped and excess will flow out when placing the temporary. There is a 2-minute working time with the temporary cement. Seat the temporary crown on the prepared tooth. A patient would be instructed to bite gently on a cotton roll for 2 minutes. For the typodont, we will hold it in place with our fingers. An explorer or a universal scaler can be used to remove excess cement from the gingival margins. A piece of floss with a knot can be used to remove interproximal cement. The floss should be pulled through the contact and not pulled incisally to avoid removing the temporary crown.